NBC10 breaking news.
Good afternoon. I'm Tracy Davidson. We come on the air as Mayor Kenney is announcing new COVID restrictions across the city of Philadelphia.
The strains of our great hospitals are already showing. COVID-19 hospitalizations have jumped 600% in the last 7 weeks. So today we are announcing a series of changes to the current restrictions that will be effective this Friday and last at least till the start of the new year. We do not take any of this lightly. And believe me, more than anything in the world, I wish none of this was necessary. But there's no doubt these changes are necessary. We need to act now to reduce the rate of increase and to flatten the curve once again. This will help ease the potential burden on our hospitals. It will help slow the spread of the virus. And most importantly, it will save lives. We put a lot of thought into these new restrictions, which Dr. Farley is going to spell out in a few minutes. I've been part of numerous meetings over the last few weeks after we recognized that further action would need to be taken. They were not easy conversations, and none of us take this lightly. The changes we're implementing this week are based on data and evidence from health and how cases spread. But to be clear, in all these meetings, every single restriction and change was discussed with the understanding that they will impact businesses. They'll impact jobs. They'll impact people's lives. That's why last week, we, along with City Council, announced an additional $30 million for rental assistance and small business relief. This brings the city's direct support for small businesses to nearly $39 million and for rental assistance to more than $39 million since the start of the pandemic. Our finance director and chief recovery officer are working aggressively to maximize every dollar from the original CARES Act and other federal and state supports. We continue to lobby Harrisburg relentlessly for the General Assembly to allocate the Commonwealth's CARES Act dollars so they go to the areas most impacted by the virus, and on Capitol Hill for additional relief, particularly urging Congress to move quickly on a new stimulus package. We hope to bring you more information in the coming weeks on additional relief that may be available. But please know we will have no stone unturned in the effort to help Philadelphians get through this. I believe that we will get through it if we act with urgency like we did in the spring. We flattened the curve then, and I'm confident that if we get past our COVID fatigue and again take this as seriously as it is, we will get through it again. So hopefully these restrictions will only be needed for 6 weeks. And now, Dr. Farley, please.
Thank you very much, Mayor. We've been with the coronavirus now for 8 months, and everyone's tired of it. Unfortunately, the epidemic is approaching its worst. I'm going to lay out the situation. I'm going to lay out the future, which I think is a little grim if we don't take strong action, and what we feel we must do to reduce the consequences. First, a few numbers. Since yesterday, we've identified 654 cases of the coronavirus infection in Philadelphia residents. And since Friday, we've identified 2,564. Now, last week, by the date of sample collection, we averaged 657 cases per day, which is the highest average case count ever. And even that, the numbers are incomplete with delays in reporting. And so I'm sure that by the time that we get all of our numbers in last week, we will average more than 700 cases per day. Now, last week, of people tested, 13.4% tested positive, and that percentage positive is also growing rapidly. Since Friday, we've identified 8 additional deaths from the coronavirus, bringing us to a total 1,917 since the beginning of the epidemic. Now, while we're seeing increases in cases and increases in deaths, we're also seeing increases in cases in nursing homes and other congregate facilities where vulnerable people live. I want to give you a better sense of the overall sweep of the epidemic and where we might head if we don't do these restrictions. And to do that, I'm going to try to show you some slides here. I'm having trouble. I can't find my screen to share my slides. Can you still hear me?
Yes, Dr. Farley, we can still hear you, but we are not seeing the screen. Let me just check the settings on my end. You should be able to.
All right, I've got it now. I've got it now, Mike.
We're not seeing it, though. We're good now. You just need to full screen. Yeah, perfect. There we go. Thank you.
All right. Sorry for that. This is a graph of the number of cases we're getting reported of coronavirus in Philadelphia residents by week since the beginning of the epidemic. As you can see, we peaked in around early April with the epidemic in the spring wave, but since September, we've been rising at an exponential rate. Now, people use the term exponential growth incorrectly often, but this is truly exponential growth. We're increasing about 4% per day. That means that the number of daily cases is doubling about every 17 days, which means that we're on track to have about a fourfold increase in the cases by December 31st of this year, or more than 3,000 cases per day for just the city of Philadelphia alone. Now, that may seem like an unreasonable projection, but let me tell you that the rates in North Dakota right now on a per capita basis are higher than that, and they're still going up. So that potential certainly exists. This is a graph of the trends and the number of people who are hospitalized in Philadelphia hospitals with the coronavirus. As you can see, that this has doubled in about the last 11 days. And the number we're at here, about 500, is more than we had on April 7th, when we had already shut down the city 3 weeks earlier. So we're clearly on track to exceed the peak of about 1,000 patients in inpatient hospitals that we had in April. And we may totally exceed the hospital capacity of the entire city by the end of 2020. And the question is, how many people will die as a result of this epidemic wave? Well, we don't know for sure, but here are a couple different models for what might happen in the future. We know that deaths tend to lag behind the reports of cases, and they lag behind the hospitalizations. Right now, we're having about 15 deaths per week. These two models, we may have between 700 and 1,400 deaths just by the end of 2020. And those rates, as you see, are still increasing. And the overall estimates are that this spring wave will lead to about as many deaths as we had. This fall-winter wave will lead to about as many deaths as we had in the spring wave, which is 1,700. So let me stop the share here. So the bottom line is this: if we don't do something to change the trajectory of this epidemic, the hospitals will become full, they'll have difficulty treating people, and we'll have between several hundred and more than 1,000 deaths just by the end of this year. Fortunately, there are things we can do now to save some of those lives and to keep our hospitals from being overrun. By keeping people away from each other as much as possible and wearing masks whenever they do interact, we can reduce the spread. Here's what we know about the settings in which the virus is spreading in Philadelphia now. It's spreading within households, among household members. It's spreading during household visits, when friends or relatives visit from one household to another. It's spreading at small social gatherings, when friends get together to watch a football game on TV, or they get together for brunch, or a soccer team has pizza after practice, or parties among college students. It's spreading in larger social gatherings, like weddings and funerals and baby showers. It's spreading in restaurants. It's spreading in offices, particularly when people get together for lunch without wearing masks. It's spreading in carpools. And then this is the thing that's maybe the biggest worry of mine, is this spreading a little bit everywhere. You know, about half of people with this infection don't know where they got it from. We know that people are generally very active right now. They get around, they shop, they work, they visit, they meet, they interact with others in many different settings. The data we get from smartphones say that in early April, when we had the shutdown, people greatly reduced the time that they spent out of home and interacting with other people. The epidemic subsided very quickly, but that activity now has returned nearly to pre-epidemic levels. So those are all the different settings that we know, and in many settings we don't know where this virus is spreading. Now, fortunately, we have models for how we can turn this epidemic around. We know that in the spring in Philadelphia, we closed all non-essential businesses and activities, and the epidemic peaked about 4 weeks later and then fell fairly quickly. But no one wants to have a lockdown like that again. Maybe what's a better model now is what's happening in Europe. Now, France and Spain and Germany and Italy and the United Kingdom all had case rates that were rapidly rising, actually higher than they are in the United States. After some delay, they put in place a group of restrictions. And it varied a little bit from country to country, but generally they prohibited gatherings. They closed bars, restaurants, retail stores, theaters, gyms, and museums. But interestingly, they left schools open. And the best news out of the past couple of weeks is it appears to be working. Case rates are leveling in Germany and in the United Kingdom, and they're falling in France. That change happened pretty quickly, about 2 to 4 weeks after they put the restrictions in place. So the painful scenario that I just laid out is not inevitable. It can be avoided, but we have to take action now. So we'll put in place restrictions to keep people from different households away from each other. When people do interact, to promote and encourage activity to be outside where there's much better ventilation, and to have people maintain their distance and use masks. We'll put special emphasis on where we know the spread is occurring, all while trying to minimize the harm to the economy and to jobs. So this is our fall and winter version of precautions that we're labeling safer at home. Because while we won't prohibit people from leaving home and interacting, we want to strongly discourage that because it's increasingly unsafe to interact with anyone. So here are the specifics. We will prohibit indoor gatherings or events of any size in any location, public or private. It means no indoor parties, group meals, football watching groups, no visiting between households, no indoor weddings, funerals, baby showers. We know that's a very strong policy, but this gets at the most important sites of spread. And we'll have limits on outdoor gatherings. We will restrict outdoor gatherings to 10% occupancy or 10 persons per 1,000 square feet. A cap for very large spaces of no more than 2,000 people. That means there will be no fans at football games. And for outdoor gatherings, no food and beverages can be served so that we can ensure that people can and will wear masks. We'll also prohibit indoor dining at restaurants. We know that many restaurants work very hard to follow our precautions, but people indoors gathering together not wearing masks right now is simply too risky. Then we'll restrict outdoor dining to household members only, and as part of that, having the tables be no more than 4 seats. Now, we need help from residents and restaurants on this one. I routinely see groups of people, 6 or sometimes more, young adults, in an outside seating, eating or drinking together. I can't be sure, but I think it's very unlikely that they all come from the same household. What we need to do is to keep this virus from jumping from one household to another. And people mixing without masks from different households is exactly how the virus does that. We can't enforce this, but we are asking residents and restaurants, please, people eating outdoors without masks should be there with their household members only. Now, retail, we will allow, but we will have a reduced density of the people in retail stores, no more than 5 persons per 1,000 square feet. This was the density we allowed when we first reopened retail stores, but since then the stores have generally stopped enforcing that and we've increased our limit. We're lowering that limit again and asking stores to enforce that limit again. And we'll require stores to enforce mask use in their staff and in their customers. Don't serve or allow anyone to enter into these stores if they're not wearing a mask. And for workplaces, we're saying people must work from home unless it's not possible for them to work from home. Then here are other businesses and activities that are closed, prohibited. We'll close youth, community, and school sports. Now, as an aside here, we know that many teams have been traveling to suburban counties to do those sports. We're asking those teams to please stop doing that. You're putting everyone at risk by doing that right now. We'll also be closing gyms and museums and libraries. Now, what about religious institutions? Those will be allowed to stay open, but with a reduced density, no more than 5% occupancy or 5 per 1,000 square feet. And we encourage all religious institutions to hold their services online only. Colleges and high schools will be prohibited from having in-person instruction. They'll be instructing online only. Now, however, childcare in schools will be allowed, childcare in elementary and middle schools will be allowed to continue having in-person instruction, as well as access centers, under safety protocols that the Department of Public Health has disseminated, in particular with everybody wearing masks and distancing. The reasons are this, that children almost never get seriously ill from COVID, and that education of children is crucial to our future. You know, we haven't lost much if we have to eat takeout food, but we've lost a lot if our children don't get educated. We also know that our essential workers, like medical staff, need childcare so that they can work. And we have the example now from Europe that says that you don't need to shut schools in order to succeed. Those are our restrictions. There is going to be detailed guidance on all these different restrictions and settings, which will be posted on our website tomorrow. Those restrictions are going to be in place from this Friday, November 20th, through January 1st, 2021, 6 weeks. But I want to strongly encourage everyone to voluntarily start these restrictions now, today. so that we can start getting this epidemic back under control. With these sorts of epidemics, the earlier you intervene, the more successful you are. Now, right now, these restrictions apply only to the city of Philadelphia, but they would be much more effective if they applied in the entire Philadelphia metropolitan area. So I'm asking today neighboring counties in Philadelphia, in Pennsylvania, in New Jersey, and in Delaware to put in place similar restrictions. You know, we all use the same hospitals, we interact with each other, we're all in this together. Now, I know these restrictions are tough. People are going to be put out of work, and some businesses may go under. But we also know that the consequences to health of not doing it are really bad. Hospitals can be overrun and unnecessary deaths. And we also know that there are consequences to businesses even if we don't. As case rates and deaths rise, and people see more of their friends and relatives sick, and the hospital's getting full, the fear is going to keep people home anyway. And if we do this right, our businesses will recover faster because the epidemic wave will subside sooner. Now, these restrictions are what we in the city can do, but our success depends more on what every resident of Philadelphia does individually. So we're asking for help from everyone. Please stay home, away from others as much as possible. Don't visit or have other visitors, even friends and relatives in your home. Don't go to work unless it's absolutely necessary. If you have to go out, keep your distance from others and wear a mask. Do that for your own sake, as well as the sake of your family members, your friends, and the city as a whole. As I've said, this is a difficult period, but we will get through it. We've lasted with this virus 8 months now. We can last a few more months more. A vaccine will be available in the coming months. We simply need to tide ourselves over until then. Thanks very much.
Thank you, Dr. Farley. And now let's go to Armando for the Spanish language translation of the mayor's and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney para el 16 de noviembre del 2020. Buenas tardes. Como bien saben, nos encontramos en una etapa peligrosa de la pandemia. El número promedio de casos positivos del COVID-19 reportados.
You have just been listening to the new restrictions put into place across the city of Philadelphia. They go into place on Friday, but you heard there Dr. Farley saying we are asking people to voluntarily abide by these restrictions. Now, bottom line, he says, stay home, no visitors in your home, and only go to work if you can't work from home. We will break down all of this, get reaction to all of this, and towards